Welcome to another episode of On the Line. I'm Joe Mullings, and in studio today, we're super excited. We have Brian Johnson, the president of MassMEDIC. Came all the way down, what is this December? My Walter doesn't want me to give the exact date, but we're in December right now, and it's cold as hell in Boston, and it's a little nicer here. So Brian, welcome.
Thank you. Thanks for having me.
So for those who are not familiar with MassMEDIC, I won't do it justice. Brian, would you give us a little explanation and tell us what the organization's about?
Sure. Well, MassMEDIC stands for the Massachusetts Medical Device Industry Council. We're an association of 300 MedTech companies operating in and around primarily the Commonwealth of Massachusetts and the rest of New England. Our members range from very small startup MedTech companies all the way up to multinational conglomerates like Boston Scientific and Johnson & Johnson. So it's a diverse array of companies that are really working to change the paradigm of care in healthcare through technology.
And Brian and I got to know each other. I'm fortunate enough to sit on the board of MassMEDIC, and other peers on MassMEDIC are president of Zoll, right?
Yes.
Go ahead, drop some hammer names.
Yeah, I mean, our board has great representation. I mean, every Abiomed, Boston Scientific, Johnson & Johnson, Medtronic, Olympus, Smith & Nephew, Zoll. I'm afraid to leave one out.
Right.
So I'm not representing them all, but in MedTech, those are brand names. Yeah. So you really judge by the power of your board. And in the association world, so we punch pretty heavily for our size of our organization.
Yep. And what are the goals of MassMEDIC in general? And then we'll cut into a little bit about your background, but I want people to put context around things.
Sure. I mean, well, MassMEDIC was formed in 1996. It kind of sprung out of the recession of the early 90s. Massachusetts has always been traditionally, and this is one of the parts about Boston that I love, is a city of reinvention. So, little known fact, it used to be the shoe capital of the world until it went to Milan. So there's a district called the Leather District in Boston, which is now trendy and lofts and restaurants, but actually that's where there used to be all tanneries there. So, but then that went over to Milan. So the history of Boston has always been one of reinvention. Industries spring up, technologies are created there, then they leave. Well, in the 90s, this started to become a concern because we lost the personal computing world, moved away from Boston. And they said, hey, how do we keep these industries here? We're tired of basically planting seeds in Silicon Valley. MassMEDIC was one of two organizations representing the life sciences sector. And for 22 years, it has supported the MedTech industry by first defining the MedTech industry, which I find really interesting. I didn't know that when I took the job, but kind of digging back in. MassMEDIC is really, I would say, primarily responsible for defining the MedTech cluster in Massachusetts, because one of the initial things they did was a survey, and they found that a lot of these companies that were building medical equipment were categorized according to their SAIC codes, so they were called plastics manufacturers, but they were really producing medical equipment. So, I still look at our job as continuing to define and advocate for the industry, to make sure that it's a quiet industry. That this is an industry of engineers who, they don't exactly know how to fluff their own feathers. They do a very poor job in most cases of talking about.
And don't blame the engineers, though. Even the marketing and sales guys don't fluff their own feathers.
Well, they're a highly regulated.
I'm an engineer, so I have to stand up for us.
I mean, they're a highly regulated industry, so this is not a place where hyperbole is readily accepted. Right. But I mean, maybe that's why I'm in the position I'm in. But they need a group to advocate for them, to lawmakers, to explain to laymen, hey, look, we're not just building medical devices or medical technology. We're saving lives. We're changing your lives. Hey, you might not even know, like, you have a medical device in your body or have used a medical device. Most people don't realize they are bumping into medical technology every day. Mm-hmm. And it's just one of those things that you just kind of look past, right? You do glasses or contact lenses. You're actually you're using a medical device every day.
Your iWatch these days,
Yeah.
right?
Yep.
Your
watches
Garmin,
and-
they just Apple got approved on the cardiology side of things, right?
Yeah. So, advocacy and communication has always been part and parcel of our credo and our mission. The rest was education and events. So, that's how the industry association was founded in 1996. That's pretty much how it was run for 22 years. It's a little bit like the Chamber of Commerce, but just for the MedTech industry.
So we have a common friend who drove the Helidas organization for a number of years, Tom Summer.
Yeah.
Tom Summer. And big shout out, Tom, who has handed the mantle over to you, and that's MassMEDIC 1.0.
Mm-hmm.
Now you're moving into MassMEDIC 2.0.
Yeah.
What do you hope to accomplish in the first year? So,
anytime you take over for a founder, someone told me this, it's a turnaround. And I think the first thing that I've tried to do is listen, and I'm still really listening. I had my own thoughts about MassMEDIC. I've been working with the organization on and off for 10 years. So I had some ideas as to how I wanted to drive this bus, but I also knew that kind of stepping into this role, the most important thing for me to do would be to talk to my members and figure out what they needed and what they want. But I'm also somebody who I don't want to say I drive myself on intuition, because I don't, but I feel like I have pretty strong understanding of what people might want. And, what I first noticed right away was we needed to communicate better, and somebody needed to tell the story of MassMEDIC better. Mm-hmm. So that's why I talk about the past and the history, because I think it's really important to kind of talk about our future. How we laid the groundwork for the next phase of MassMEDIC. I look at MassMEDIC holistically as my job is to make sure that Massachusetts is branded as the MedTech capital of the world. I think they do a great job of it in Minnesota. I think California, MedTech is actually gigantic in California, but it's actually two different states there. There's Southern California, Northern California, and I think, it's not really known as a MedTech place, even though it's the largest population of MedTech companies in the world.
Because everything's a reference point, right? Because everything after that is computing, right? And genetics and genomics and everything.
Yeah. So, I look at it. So we have to continue. We have to figure out how to define the Massachusetts ecosystem. How do we brand it? How do we make sure that people understand that this is the global epicenter of innovation in medicine? And it's actually, ironically enough, like when you fly into Logan Airport, if you fly into Terminal C, the JetBlue terminal, they have all these firsts that have happened in Massachusetts, and it's an entire wall of the airport of just, in 1886, this happened, in 1922, the first this. So, I want to make sure that we worked to brand Massachusetts as that global epicenter of where ideas in medicine come from. But, how do we do that? You don't boil the ocean, so you have to figure out how you can do it step by step. So the first step was communicate more, find vehicles that we can talk to our members more often and in a more casual tone, frankly. So we started a newsletter. We're working on the website. We're working on some podcasts. We're doing stuff like this, trying to get out there and talk. Secondly, we're doing a lot of surveying and listening to our members and trying to figure out what they see as the value of our organization versus what I perceive the value of our organization. And, not surprisingly, there's a delta there, and that's, I think that's good, because that means we have a clearly defined mission. Because I think what I see and what other people see, we have to align that towards a united vision. So part one was communicating better. Part two is creating this idea from moving from networking to creating a community. When you're networking, it's transactional. It's I'm handing you a business card and I'll tag you on LinkedIn, and then maybe we shoot an email or two, and then maybe we have lunch, and we start building a relationship. A community is really, I'm joining this group of people that have shared ideals and shared vision. And so we want to have an association that is a community. We all have the same ideals and vision for our MedTech community. Number 3 is creating what I call memorable events. So events that are stylized, that show off a little of the pizzazz of MedTech, that highlight the voices in our community. Because there's a lot of remarkable people doing, I would say, jaw-dropping work, frankly.
Mm-hmm.
You know, I've covered a lot of industries as a reporter. I've never covered an industry that just kind of just blew my mind in so many times. I think medical and technology innovation is the most exciting innovation.
Yeah.
Sadly, it's the sort of the least understood, so it's the least covered.
But that's our own fault, isn't
Yeah.
it? I mean, the MedTech you pointed out earlier, people don't really understand the science and technology that goes into it, number
Yeah.
one. And number two, you know, we do a lot of recruiting out in Silicon Valley.
Mm-hmm.
And when we get on the phone, one of our really sobering questions is, would you rather keep somebody on Facebook for another 38 seconds with that algorithm, or would you rather put that algorithm into a device that sits inside of a patient in an ICU, CCU, and if not but for, they wouldn't be sitting at the dinner table this holiday season.
Right.
And people pause for a moment and say, shit, I've never really thought about that. And I'm like, no, now's the time to think about that.
Yeah.
And I think you're right. I think we have to bring that aha moment to the industry. And we, and I use we because I've been in MedTech for 29 years, have not done a good job of doing that. And we always blame it that we can't make regulatory claims because the FDA is going to come after us. And I hear that all the time.
Yeah.
But if we're not making regulatory claims, but we're making claims about the changing of humanity because of the products we make, we've been lame and not doing that well.
Well, I think it's about sort of this technology problem paradigm, right?
What do you mean?
So, I mean, well, one of the things that I really want to try to define, and one of the programs we're going to launch in 2019 is our startup program that ran for 10 years and is now being restarted. And I really look at some of the issues around MedTech as sort of the paradigm of technology problem, you know, technology looking for a problem to solve. So everything starts with the technology. So the conversation, the vision, all is centered around the technology. And I think if you step back and you look at technology it's just an instrument. It's just a vehicle to solve a problem. So I think what we have to do as an industry, we have to do this better, is define the problem that we're seeking to solve and talk about technology as one of the tools in our arsenal. You know, we're not just, you know, creating a piece of equipment that is going to fix this condition. No, we're seeking to heal this condition, right? And then, you know, our technology is part of that. And I think, you know, it's kind of part of that, like, what do you do? And then, you know, somebody coming up to an engineer and saying, you know, what do you do? Well, I create an articulating rotator piece of machine. It's like, no, what do you do? Right. And it's like, well, you know, I'm a mechanical engineer. And
what do you do?
No, what are you doing?
I build a robot that saves lives.
Yes, exactly.
Right? That's where we have to go.
Yeah, and we have to have that in our DNA more. Mm-hmm. And I think the beautiful part of our industry is that it's not an industry filled with fluff. Mm-hmm. But, you know, I mean, I don't come from this industry as a background, so when I come in and I say, no, you got to keep dumbing this down until I understand it, right? I went to Emerson College and
wait, don't.
Great school.
You're not looking
great
for
school.
Right.
I was a film major. I need you to keep going until we hit this point where I can understand, right? But I mean, that's always been for me, is like when I interview people, my first question is like, you know, act like you're explaining this to a 4-year-old and tell me what you do. And, you know, I think that, you know, that's the challenge. And I hope we can bring some of that.
What prepared you for this? Tell us about your background. Where'd you come from? Where'd you grow up? Give us a good 2-minute on that.
Yeah, I mean, 2 minutes for 43 years. Okay.
But you're a communication major.
Well, I mean, I'm originally from New Jersey.
What exit?
Elizabeth, New Jersey. So we are known for The Sopranos and Scientology.
That's right.
So it's a legacy that we carry. Moved to Boston at an early age. My dad actually brought us there. He was for a job selling rugs, and we ended up in Massachusetts, right outside of Boston. And so I ended up growing up in a place called Newton, Massachusetts, which is about 5 miles outside of Boston. Grew up there. Went to school in Emerson College. Got a bachelor's degree in film. Ended up in Los Angeles as in the movie business first. So as a script reader, I was a dog walker.
Nice. Nice. Everybody in entertainment.
A candle maker.
Right,
yeah.
Right,
No, I remember
candle maker.
Oh yeah, I had every job you could ever think of. I think I was carrying about 3 or 4 jobs at one point. Just to make ends meet. I was 21 years old, and I just said I'm going to my parents. And
What year was that?
1997.
Okay.
No, wait, 96, 97, somewhere around there. Kind of blocked it out. I actually didn't even have my driver's license. I had to learn to drive to go to LA. So my first time driving, I was on Santa Monica Boulevard, and I was white knuckled the entire way. I was afraid to take lefts. So I had to figure out a way to get to work just by taking rights.
All right into
Yeah.
like a UPS driver.
It was really scary. But I was really lucky. My first job was as a scriptreader at 20th Century Fox. And it was a place called Fox 2000. And it was run by this producer named Laura Ziskin, who is one of the titans of Hollywood, one of the best, most successful women producers of all time. Huh. And I'll never forget my first day of work. I'm so excited and so nervous. You walk into a movie studio your first day on your real first job, and it's like, oh my God, there's Jimmy Smits. Oh my God, there's Dennis Franz. Oh my God, And then, so I get there, and Laura Ziskin, she's like, you ever see Devil Wears Prada?
Sure.
I mean, she's that, right?
Okay.
And she comes out. At one point, she just comes flying out of her office. She's like, everybody, listen up. There has been a leak to the press. And if I find out which one of you leaked that, your career is done, okay? Done. And then she goes, thank you. And then goes back in her office. And I was like sweating bullets. Even though it was my first day, there's no way, obviously, I was leaking anything to the press. And one of the producers comes to me and goes, oh, you're toast.
Somebody hang the new guy.
But the reason why I was so... I don't know. For me, it just working for her, and it was classic Hollywood, right? So it was like, Laura wants air popped popcorn, so you got to go get her a popcorn maker, and I'm driving around Los Angeles, like a maniac, sweating bullets,
Not making any lefts.
trying to find this air popper, because it has to be a specific type. So I bring her. It took me 2 hours to do this mission, and I pop up this perfect bowl of popcorn and bring it in,
That's great.
And she takes one kernel, pops it in her mouth, she goes, it's perfect. And she never had another kernel of that popcorn, and it just kind of taught me, well, A, I don't think I want to be that kind of boss if I ever get to the top, but B, your career is just. You just got to learn how to manage and balance these big personalities. And, for me, frankly, I was a little too timid at the time, but I've had the real pleasure of working for very powerful women my whole career, and watching how they comport themselves. It's been a real pleasure, and I think really important for me to see that. Because, talk about competent, these women got to the top by being super competent and by taking, in many cases, no prisoners.
Heavy fire, no air cover oftentimes.
Yeah.
And actually, I'm going to hijack this.
Yeah.
You're doing something specifically at MassMEDIC, a new event or a new series of events in regards to female leadership in MedTech.
Yeah, one of the things that I immediately, when I took the job, I said, what I want to do is help create better arenas for mentoring for women. And one of the things that sort of studies suggest is that women have told me that we don't have enough other female mentors. You're usually being mentored by a man, And I think it's really important that we create sort of organic networks of women mentors. So we've created this Women's Leadership Forum. And really what it is it's a tentpole event. So we're going to interview a successful woman executive interviewed by another woman, and have, after the event, structured time where people can sit down at a table and network. And it's really not going to be about their career. I mean, it's not going to be about their company. We're hoping it's not super transactional. We'd like them to network and try to talk about their careers.
Do I have to be a MassMEDIC member to attend that?
You don't, but you'll pay a different price if you're not there.
So it'll be open to the public, though.
I'd like, yes. I'm a big tent person. I mean, we're clearly, if you're a member, there will be benefits that are not open to the public. But this is something that I feel strongly that the MedTech community should lead on. It hasn't led, but it should lead. There's healthcare is an industry dominated by women, but the executive level, it's woeful. 1 out of 8 executives is a woman. And I think I was talking to one of the great sort of women leaders in the industry, Stacy Pugh of Medtronic.
I know Stacy really well.
She's awesome, she was saying, even a lot of organizations, if they put a woman at the top, they feel like we've solved our women problem, and that's clearly not right. You can't, that's just not it. I mean, you have to build a culture.
That's
around,
a throw a bone mentality. That's not it. Yeah.
So you have to build a culture of inclusion, and I think. If we as an association lead on that, and it's not just, inclusion isn't just women, it's people of color, it's people from varied backgrounds who might feel like they're not welcome in the MedTech industry. We want them to know that they are, and I'm going to really seek to push the MedTech industry into different arenas, talking to younger kids in the inner cities, and get people more involved in this space, because the healthcare in general is a very inclusive environment. I mean, you go into a hospital, you see a lot of people of all different stripes, and our industry, which caters to people of all races, colors, and genders, needs to embrace that.
Yeah.
And I think they want to. I think it's just they just need push
And
it.
so for those listening right now, where can they go to in order to check on dates and availability?
We'll have it up on MassMEDIC.com, and the events we'll be unveiling the events over the next couple of weeks.
Yeah.
So it'll be kind of part of a busy 2019 for us.
Awesome.
We really want to change the thought process of how people see us through our events.
So we got through your movie career.
You got about 2 months into my career.
Yeah, no, but you had, before you came to MassMEDIC, you had started your own venture and successfully exited it.
I did.
And I think it sets you up really well for bringing into MassMEDIC what your initiatives are. Can you share a little bit about that?
Sure. So, I mean, fast forward from Hollywood, I ended up in the newspaper business, and I was a business reporter at a newspaper called the Eagle Tribune up in Lawrence, Massachusetts. And, I covered some med tech companies, but I didn't really know too much about them. But it was an industry that I was very aware of. My father was at U.S. Surgical, and so I knew of the industry. But I'd covered successful business people for a few years and decided, I knew I was always entrepreneurial and I wanted to start something. And, I left the paper because I was just making woeful money, and I was, starting a life. And, I did a little work at a consulting company that was working in MedTech, but I immediately missed the pace of journalism. It's one of these jobs that, once it's in your blood, you have to sort of get a full blood transfusion to get it out, because life seems pretty boring if you don't have a deadline every 6 hours. But I was really coalescing around online media, and I knew I had done a little bit of sports blogging for fun, anonymously, and actually had built up a pretty good audience doing that. So I said, well, you know what? I can build an audience, and I'm a pretty good writer, and I think I can do something like this. So yeah, I actually read a magazine article, blogging for dollars, and they said if you don't need to get millions of readers if you have a really strong demographic. And it's kind of one of those aha moments. I ended up ironically at a MassMEDIC investors conference for this company and scouting companies, and I had this idea churning in the back of my head, and I just said, oh my God, this is what I'll do. I'll just bring this energy in this industry online every day, and I'll start a blog. And this is a rich industry, and I started looking into it, and sure enough, it kind of all fit together. And I went home and I bought this domain called massdevice.com, and I started putting together a business plan. I recruited a former colleague from a grad school in a newspaper business, Brad Perriello, and I said to him, over sort of a barbecue, I have a great idea, and you need to be a part of this. And he sort of said, send me some more info on it. Finally, didn't take too long to convince him. But sort of this idea of massdevice.com was born, and this was really our idea, was a daily newspaper for the MedTech world. And what the idea was, I remember saying to people, sooner or later we all need a medical device. Mm-hmm. It's inevitable. Mm-hmm. So why don't you read about it here? And we wrote a really nice business plan. We went out. We had a pretty nice investor deck. We went out to raise money in the fall of 2008.
Good timing. Great
timing. We were actually on the pitch when the Lehman Brothers folded, mm-hmm. which was a sobering moment.
Yeah.
And then at that moment we said, I said to myself, there's no good time to start a business, and we're just going to go for it, and we'll just go 1.0. So we launched in March of 2009. The Dow Jones was 6,000 that day. And to me it was perfect, because I was like, all of our mistakes will be covered. Nobody's killing it right now, so we can suck for a while. We can learn the business, and then when this economy recovers, we'll be ready.
Yeah.
And we'll be in good shape.
Good philosophy.
Yeah, sure.
It is a good philosophy.
There's amazing how many philosophies you can create out of necessity, right? So Mass Device, from 0 readers to 10 years later, today, they're going to do probably 1.5 million to 2 million readers this year. Mm-hmm. It's a flagship of a medical device network that we built. I built it from 2009. I sold it in 2015 to a company called WTWH Media. We actually signed the closing docs on the same 6 years to the day that we launched the publication, which was really cool. And then, we launched an event called Device Talks in 2011, kind of built around CEO conversations. And then in 2017, I knew I was ready to move on. It'd always been a goal of mine to walk away from this venture. I always thought a venture isn't successful unless it survives its founder leaving. And I don't know if that's a universal thing, but for me it was. Mm-hmm. I felt success would be sell it, walk away, financially more stable, and then the venture can live on without me. It was always important that it lived on without me. Yeah. And it's thriving today, which is fantastic. And I'm really proud of what we did. I'm really proud of the people that I brought in, gave them start to their careers. That's the beauty of entrepreneurship. And I think, unfortunately, we obsess about the exit. Right. And anybody who's ever sold a company understands, as soon as you sign those papers,
right, your baby's gone.
Well, yeah, it's just but if you have the fire in your gut to start a company, all these milestones, they so quickly pass, and
you don't even pay attention.
Yeah, you're on to the next thing almost instantly. It was like, whew, go have a nice dinner.
Yep.
And then I
What's
started,
next,
yeah,
then?
saying, oh my God, now I got to build this thing even faster. Like we're actually at day one, which is the.
So you're bringing all that experience now into MassMEDIC.
Yes.
Yeah.
Yeah. So MassMEDIC, now I'm going to be speaking for these companies in a constructive manner. I feel like I can do it because I've spent the last 10 years immersed in this space, covering it, talking to almost every major CEO in the industry. I've been blessed with a great network, and the industry really embraced me in a way I've never had in my professional career. I was always, through Hollywood, journalism, was always struggling to get, recognition. Which is a mistake, because I still remember I was working for Roger Corman Studios. He's the king of the B movies, right? And I remember this guy came in and he once said, we're building Titanic quality movies for the budget of their craft services. I was like, okay, got a little inflated ego. There's literally a woman here living out of her VW bug who comes to work so she can eat for free. But so
That's that industry.
So one of my jobs was I was on B camera crew on this terrible TV show, which featured like washed up movie stars and Playboy Playmates. And one of my jobs was a camera assistant on the B camera. So B camera does a lot of stuff like run into a building. If there's an explosion, a burnt doll's head has to fall down. So somebody has to actually film that junk. Right. So you don't waste stars' time. So, they would put me in the suit, and I'd pretend to be the leading man running into the building. And one of my jobs was we were doing car pickups, right? So this black Scorpion mobile will be driving down Venice Boulevard 3 a.m. in the morning. And my job was literally to hook my arm in this cargo van, hook my arm around something to stabilize myself, and then kick the back door open and then hold it with my leg. For dear life, as we're driving 40 miles.
That was on your resume?
And then at the end of the night, I'm like, oh my God, how am I ever going to get out of this thing? Like, what am I doing in my life? And the camera guy goes, hey man, first 10 years, it's who you know. Second 10 years, it's what you know. So, for me, it was, the 10 years is who you know, and now it's about what I know, and it's a really cool place to be. So, I have to take all that knowledge for 10 years of this industry and put it towards making Massachusetts the destination for MedTech.
It's going to be fun to watch that. I get to sit on the board with you, and I think your vision and your previous experience is going to leverage up and raise the game. Tom did an unbelievable job at MassMEDIC 1.0, and I'm going to look forward to watching MassMEDIC 2.0 with you and being part of that journey. So
yeah, it'll be fun.
I appreciate you coming on today.
Yeah, it better be fun.
Otherwise we're not going to show up. And again, they can follow you and the organization on MassMEDIC.com.
You follow us at MassMEDIC.com. You can follow me on Twitter at MassMEDICPrez. I think that's what we'll.
And then LinkedIn.
And then LinkedIn. I'm on LinkedIn. Yeah, somewhat active. Pretty active.
Awesome. Good. Well, I appreciate you coming by today.
Thank you. It's my pleasure.
So another episode of On the Line. I'm Joe Mullings, closing out and wishing you all a very happy New Year. And if this plays after the New Year, Walter's giving me the cut sign on the throat. I hope you had a great, safe New Year. Be well.